Coronavirus. China's new coronavirus is spreading fast. More than 20,000 people are known to be infected and at least 427 deaths have been recorded. The bulk of cases have been confined to China, but the virus is spreading. So far, cases have been confirmed in some 25 countries, including the UK, France, Germany, Italy, Australia and the United States. What is a coronavirus? Coronaviruses are a family of viruses that cause disease in animals. 7, including the new virus, have made the jump to humans, but most just cause common cold-like symptoms. 2 coronaviruses, Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS), are much more severe, having killed more than 1,500 people between them since 2002. The new virus, known as Wuhan coronavirus 2019 nCoV, is also more dangerous. So far, around 15 to 20% of hospital cases have been classed as severe, and the current death rate stands at about 2%. What are the symptoms caused by the Wuhan coronavirus? The virus causes pneumonia. Those who have fallen ill are reported to suffer coughs, fever and breathing difficulties. In severe cases there can be organ failure. As this is viral pneumonia, antibiotics are of no use. The antiviral drugs we have against flu will not work. If people are admitted to hospital, they may get support for their lungs and other organs as well as fluids. Recovery will depend on the strength of their immune system. Many of those who have died were already in poor health. How quickly do symptoms emerge? Symptoms are thought to appear between 2 and 10 days after contracting the virus. There is also some evidence, as yet unconfirmed, that the virus can be spread by asymptomatic people, that is, people who carry the virus but are not yet very sick. If this is correct, it may make the virus considerably dangerous. How is the new coronavirus spread and how can you protect yourself? Hand hygiene is the first and most important line of defense. Like cold and flu bugs, the new virus is spread via droplets when a person coughs or sneezes. The droplets land on surfaces and are picked up on the hands of others and spread further. People catch the virus when they touch their infected hands to their mouth, nose or eyes. It follows that the single most important thing you can do to protect yourself is to keep your hands clean by washing them frequently with soap and water or a hand sanitizing gel. Also try to avoid touching your mouth, nose or eyes with unwashed hands, something we all do unconsciously on average about 15 times an hour. Other tips include: carry a hand sanitizer with you to make frequent cleaning of hands easy. Always wash your hands before you eat. Be especially careful in busy airports and other public transport systems, to touching things and then touching your face. Carry disposable tissues with you, cover your nose and mouth when you cough or sneeze and dispose of the tissue carefully. Do not share snacks from packets or bowls that others are dipping their fingers into. Avoid shaking hands or cheek kissing if you suspect viruses are circulating regularly. Clean, not just your hands, but commonly used surfaces and devices you touch or handle. Is there a vaccine for the new coronavirus? There is currently no vaccine, but researchers in the US, UK and China have already begun working on one, thanks to China's prompt sharing of the virus's genetic code. However, any potential vaccine will not be available for up to a year and would most likely be given to health workers that most at risk of contracting the virus first. For now, it is a case of containment. China has started building several 1,000-bed hospitals to treat patients, which it hopes to finish within days. Capacity to treat patients who require both ventilation and isolation will also be the biggest challenge for the NHS if the virus takes hold in the UK. Always remember, prevention is always better than cure. Share the information, don't forget to hit the like button. And subscribe. Advance knowledge.